Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response here in Lincoln. Joining me again is interpreter Francis Ravage. Thank you, Francis, as well as to all of the media and listeners who are tuning in to these briefings. We want to remind everyone to please visit our website at covid19.lincoln.ne.gov, where you can learn more about how to protect yourself, your loved ones, and our community. At that site, you'll also find more data about the cases that we're investigating and the testing that we're doing here in Lincoln and Lancaster County at our online dashboard. And that dashboard is updated twice a day, once in the morning and once in the afternoon. Today in Lincoln, we've had 36 individuals test positive for COVID-19. However, we have just learned from the state that this number represents data for the past several days. As the governor mentioned today in his briefing, there have been technical difficulties in reporting from the state's public health lab that his team is working to remedy. Over the last 4 days, however, we have had 73 individuals test positive for COVID-19. That's nearly 38% of the total number of cases for our community, which now stands at 193 total. While we are concerned, of course, and focused on preventing the spread of COVID-19, these higher numbers are not unexpected, given that we now have been able to perform an increased number of tests each day. Here to provide more details about the Lincoln-Lancaster County Health Department's investigation of these cases is Health Director Pat Lopez.
Good afternoon. Of the 73 new cases reported since this past Sunday, 23, or about a third of them, those that have been connected to Smithfield and Crete. We are ensuring that these people are isolating and close contacts are quarantined. As I mentioned before, we are working closely with Public Health Solutions, the local health department in the Crete area to coordinate our response and mitigate the spread. The positivity rate, the number of positive cases compared to the overall number of people tested, is another important measure to follow. Now that the testing is more available and more people are being tested, we have seen an increase in the overall positivity rate. The overall rate for Lancaster County has increased from 3.2% earlier this week to 5.9%. The state is also up from 7.5% last week to now at about 15.2%, and the national rate is now at 18.5%. We talked more in depth about hospital capacity yesterday, and I do again want to thank both Bryan Health and CHI St. Elizabeth for being such great collaborative partners. Hospital capacity is another major factor in how our community is able to continue to respond to this pandemic. Today we have 9 Lancaster County residents who are COVID-19 positive, currently hospitalized, and 2 of them are on ventilators. Overall, there are 30 patients from outside Lancaster County currently in Lincoln hospitals, and 5 are on ventilators. This confirms the need to take into account the situation regionally and not just the city limits of Lincoln. There are now 3,615 confirmed cases of COVID-19 in Nebraska and 58 deaths, including the one in Lincoln. We do have good news related to testing. The Bryan Health and CHI St. Elizabeth drive-through testing sites exceeded their target of 150 tests yesterday and completed 160. Now we have a new target number. Beginning today, the drive-through testing sites have the capacity to test at least 300 people per day. This increase in testing is crucial to provide us a better idea of the extent we have community spread in Lincoln. We want to remind you about the expanded list of symptoms consistent with COVID-19. These include fever, cough, sudden onset of shortness of breath or difficulty breathing, chills, repeated shaking with chills, repeated muscle pain, headache, sore throat, and new loss of taste or smell. If you are experiencing any of these symptoms, please seek testing. The process is safe and easy and starts with an online risk assessment at chihealth.com or bryanhealth.com. At this time, only those with an order from CHI Health St. Elizabeth or Bryan Health or from their own physician or healthcare provider are permitted at the drive-through testing sites. If you don't have a healthcare provider in the community, you can contact the health department at 402-441-8006, and we will be happy to assist you.
Thank you, Director Lopez. So last week, Governor Ricketts declared his intention to relax some restrictions throughout the state to allow for gatherings at houses of worship and for the resumption of some elective surgeries under certain conditions, starting Monday, May 4th. And at the same time, the governor announced he would be issuing a new directed health measure for several counties in the state. Lincoln and Lancaster County were not included among those, but many of our residents and business owners, of course, have been asking whether relaxed measures are still planned to continue after May 6th, the expiration date of our current directed health measure. As we noted on Monday, Lancaster County saw more positive cases last week than any week to date during the pandemic. The number of positive cases is one of a number of factors we discussed in our press briefing on Monday that will be evaluated as we examine the need to make changes in our directed health measure. Interim Health Director Lopez and I spoke with Governor Ricketts yesterday, and together we concluded that an extension of our current directed health measure should be implemented through May 10th. That means that the regulations that were first put in place on March 26th will be extended an additional 4 days from the original end date of May 6th. The governor announced an identical extension of the state's directed health measure for Lancaster County at his press briefing this afternoon at 2 p.m. As a reminder, those current measures provide that gatherings of 10 or more individuals are prohibited, which includes any event convening with fewer than 10 people where the 6-foot distancing rule cannot be maintained, for example, in beauty and nail salons, barber shops, and massage therapy businesses and body art establishments. Food and beverage sales at restaurants, bars, taverns, private clubs, and any dine-in establishments remain restricted to drive-through, carry-out, and delivery only. Alcohol sales are restricted to carry-out sales and delivery only, and daycare and childcare facilities operate under restricted conditions. As we enter a new phase of our community's pandemic experience, we are fully cognizant of the difficult balance between protecting the public health and our economic vitality. And what we are working to achieve through this directed health measure is a reduction of the negative impact, both health and economic, that could result from increased transmission of the coronavirus. Over the next 10 days, we will be monitoring the factors we've discussed on Monday to determine what next steps should be taken to protect our community and strike that balance. We want to work in concert with the state of Nebraska to support efforts to carefully and safely bring our economy back to life. And that said, we reserve the right to reconsider the relaxation of measures if the status of our community demands that we do so. So with an eye toward the future relaxation of our directed health measure, we also want to be supportive and provide clear, specific guidance to those businesses that decide to operate and adjust their normal operations in order to meet the standards that the governor has established in the new orders that he plans to implement on May 11th. Here to talk about the steps that we have taken to help businesses prepare is Health Director Pat Lopez.
As the mayor said, the local directed health measure that went into effect March 26th impacted all of us. And it had a major impact on businesses whose work involves very close person-to-person contact, which increases the risk of the spread of COVID-19 in our community. These businesses include restaurants, barbershops, hair and nail salons, massage therapists, body art, and others. So To meet that need, Lincoln-Lancaster County Health Department has developed draft guidelines for reopening and operating local businesses during the COVID-19 pandemic. The draft documents can be found at lincoln.ne.gov, keyword guidance. The Health Department is seeking input from businesses on guidelines, and information on how to respond is included in the draft documents. The deadline for businesses to respond is at 5 p.m. on Friday, May 1st. We want business owners to take this opportunity to provide input to ensure practical guidance documents are implemented for their specific industry. We will need to continue to be innovative and find ways to combine public health measures with everyday business practices. Everyone has been incredibly receptive about loosening any the restrictions, and they will be done with the health and safety of the public and the people who work in these service areas in mind. Our department has solicited and received initial feedback from the Lincoln-Lancaster County Food Advisory Committee, the Nebraska Restaurant Association, the Nebraska Board of Barber Examiners, the Nebraska Board of Cosmetology, and several local owners, operators, and practitioners, along with others in the community. The Lincoln-Lancaster County Health Department also consulted documents from various national organizations and associations in developing the draft. I want to acknowledge the Health Department staff who has worked diligently to provide clear, transparent, science-based guidance to protect the health of the public, along with the business owners and operators, practitioners, and food handlers. The communication has been key.
Thank you again, Director Lopez. So we encourage all businesses impacted by the directed health measure to review the draft guidance and contact our health department staff to assist you as you make preparations and plans to reopen. We are here for you, and we look forward to collaborating on this guidance to make the transition of your operations as successful as possible. As we look to the potential relaxation of our directed health measure, we want to emphasize the importance of following the guidance of the CDC to wear a cloth face covering when you are out in public. Each person that is part of this news briefing wears a face covering before approaching the podium, and this is an important part of protecting others from COVID-19. Here to talk more about face coverings, the role they play in limiting spread of the disease, and how to make them and take care of them is a member of our epidemiology team at the Health Department, Tommy George. Welcome, Tommy.
Thank you, Mayor, and good afternoon. I'm Tommy George, and I'm an epidemiologist at the Lincoln-Lancaster County Health Department. Today, I'm going to speak to you about face coverings, including what the best practices are for using them, why it's important to use one as often as possible, and how you may make them for yourself and others in our community. First, the best practices. The most important thing to consider about your mask is how you are putting the face covering on and taking it off. This has been spoken to previously, but let me reinforce some key points. There are many different face covering options out there, but minimizing how often you're taking it on and off is important regardless of the covering type. When you're taking it off, try to keep your hands off of the part of the mask that your mouth is closest to. So grab the loops or strings that are on your ears or tied around your head instead of the part of the mask on your face. If there are no loops or straps, try to touch the edges of the covering. Try not to touch the mask where you're breathing through it. That's very similar to touching your face as far as potentially spreading the virus is concerned. It's important to consider how it fits as well. It should be snug to your face. Try to keep the face covering fit snugly along the nose and cheekbones. Another consideration is how to keep your face coverings clean. Wash your face coverings frequently with hot water and soap. I would recommend daily. The second point I'd like to highlight is how important it is that as many people as possible use these face coverings in addition to social distancing. They will help reduce the transmission of the virus to your family, friends, coworkers, and others in our community, particularly those who are at a higher risk of illness due to this virus. It's important to wear face coverings since we know that individuals who may not feel ill can still transmit this virus to others during a face-to-face conversation. Each case that we prevent by wearing a face covering is one less person that could infect somebody you care about. In addition, wearing a face covering in a grocery store, a gas station, or any other business right now, whenever possible, helps protect those who can't work from home. This final point is how to make masks. Take pride in making masks for yourself and for others. My wife, Bethany, has made over 100 masks with her sewing machine for people in our community since starting just a little over a few weeks ago. Her sewing machine has been extremely useful in helping provide face coverings to people who choose to wear them to protect themselves and others. Considering we have an infant son learning to crawl and climbing on our couch, it's difficult to put into words how proud I am of her as she balances things. Still, she's not alone. There are multiple collaboratives and volunteer groups in our great community of Lincoln doing the same. On behalf of the Lincoln-Lancaster County Health Department, I'd like to extend thanks to Bethany and all the other people in our community working to make it just a little bit safer for everybody in Lincoln by providing this service. If you're interested in helping make masks, please contact Jeanette Johnson at the Lincoln-Lancaster County Health Department. You can call her at 441-8045. We're helping coordinate volunteer efforts in response to COVID-19 and may be able to connect you to other ways you can help our community work through this as well. For example, we also need people to help sew gowns being made to help support our first responders and healthcare community. For those interested in making your own face covering, you can visit the city's COVID-19 webpage at covid19.lincoln.ne.gov. There are resources there for what materials to use and directions for how to make a face covering with or without a sewing machine. In closing, please wear a cloth face covering to protect yourself and others and help our community stop the spread of this virus. Thank you.
Thank you so much, Tommy, for that and for everything that you're doing, and thanks to Bethany as well. Again, we want to thank the people of Lincoln and Lancaster County for so responsibly reacting to the threat of the novel coronavirus. The non-pharmaceutical interventions, the remote learning, the physical distancing, the teleworking, all of it that our community has undertaken clearly has worked well. You have bought us a lot of time to prepare and have helped prevent our healthcare system from becoming overburdened. And as we move forward into the future and with any relaxations of our directed health measure, all of us must continue to be vigilant in our efforts to create barriers between the virus and our residents, and face coverings will continue to be a really important part of those vigilant efforts. And now we're going to talk a little bit about some good news. Our community's adaptations and innovations during this pandemic continue to impress. On Tuesday, May 5th, from 10 a.m. to 2 p.m., you can take part in a drive-through job fair sponsored by Gateway Mall, the Lincoln Partnership for Economic Development, and Employ Link. The way it works is that you drive to the fair location and someone will hand you a bag of information while you remain in your car. And that bag will contain currently available job openings and how to apply. There are hundreds of jobs available right now, believe it or not, right here in our community. And this drive-through job fair is a great way for you to get connected to available job opportunities as soon as possible. In addition to containing job information, the bags will contain information on free Wi-Fi locations across the city, as well as information on the American Job Center, where people can get assistance with applying for jobs and updating their resumes. 25 employers have provided information for this job fair, ranging from manufacturing to construction to healthcare to office work and more. To minimize public health risk, the people who are stuffing and distributing the bags will be wearing face coverings and gloves, and we ask that anyone who participates in this drive-through job fair remain in their vehicles at all times. So to participate, please go to Gateway Mall between Olive Garden and David's Bridal on May 5th, anytime between 10 a.m. and 2 p.m. You can find more information on our Resident Resources tab at our website, covid19.lincoln.ne.gov. A huge thank you to Gateway Mall, LPED, Employ Link, and Brian Seck for coming up with this innovative and safe way to connect job seekers with employment opportunities. And with that, I'd love to open it up for questions.
Mayor, this is Bill with 1011. Just curious as to why May 11th and not May 7th, and to what those discussions were like with the governor.
Well, those discussions,
Positive. We expressed some of the concern we were seeing in Crete and the sort of jump up in the numbers of new cases that we'd seen more recently in the last week and a half, really, than any other time during the pandemic. And given that May 11th aligns with other DHMs in the state, we just thought it would help to eliminate confusion for people in Nebraska and give us just a few more days to kind of assess the status of our community. And we really think that eliminating confusion and being aligned is important to people's safety. We want people to understand the rules and how to comply with them and also how to get prepared for them, which is why we've also spent so much time developing guidance for future relaxation of these measures.
A quick follow-up. You did say that you guys have the right to reverse course on this if you do see a sudden spike in cases. Is there any sort of threshold for that?
I think what I was referring to there was what happens after May 10th, so beginning May 11th. We want to get closer to May 10th to see what the situation is. We talked about the factors we'll be looking at. We're really proud of the strength of our healthcare system locally. We are not overburdened, and that's a really positive sign. Again, our residents and our employers have bought us a lot of time and made that possible. And so as we continue to move forward, as elective surgeries open up gradually, as we look at the testing numbers, as we evaluate our ability to do contact tracing based on the demands and the positivity rate, these will all factor into sort of the recommendations we have for what comes next beginning May 11th.
Mayor Riley Johnson with the Journal-Star.
Yeah. Hi, Riley.
When you look at that date, do you expect, based on the models you have now, that you'll see that 2 weeks of declining cases? I mean, it doesn't seem right now. I think we're less than 2 weeks from May 11th, but do you expect that the trend line will be towards fewer daily cases at that point, or?
So, Riley, it's really difficult to predict because things change so much in a day. It is just one of the many factors that we are considering. We are, of course, really pleased with our hospital capacity and our public health capacity and the promise of increased testing. Just today we doubled our testing capacity locally. So it is a balancing act that we're trying to really get right. Director Lopez is here if you want to ask any more questions of her regarding what she's going to be focused on. But I would say that this is, again, an uncharted territory that we're entering. No one's had to do this to this degree before, but we're lucky to have really talented local public health officials and access to experts. I mean, I'm on the phone with folks at the Johns Hopkins, medical security team, on the phone with the former director of the CDC regularly, as well as consulting with our experts at UNMC. We are so fortunate to have that biocontainment unit and the incredible infectious disease expertise right here in the state of Nebraska. So we are reaching out nationally, we're reaching out across the state, and of course we have our talented folks right here in Lincoln and Lancaster County,
Who are all shaping our thinking.
Riley with the Journal-Star with questions for the director.
Okay.
Good afternoon, Riley.
Good afternoon, Pat. First, I had a question from a coworker. How many contact tracers does the health department have now? And what confidence do you have in the ability for the health department to be able to do the necessary and exhaustive contact tracing that opening up the local economy, so to speak, would necessitate?
I feel really comfortable with the number of contact tracers we have. You remember, contact tracing is not new to us. It's something we do on a daily basis here in the community. It's just that we're doing a great deal more related to the virus and the outbreak. So we currently have 18 nurses that do contact tracing, along with other staff. We have staff who speak 9 different languages that work with us, and there's approximately 14 of those And we also are working with Lincoln Public Schools and recruiting school nurses that we work closely with at all times during the year, of course, and are familiar with some of the disease processes and the investigations that we need to do. So we've recruited them, and we're going to continue to work with them, and we feel really positive about our capacity.
Riley with another question. So, how much of the, extending the DHM is relying on knowing and having a clear picture of what's happening in Saline County at the Smithfield plant, given that 23 cases identified this week are associated with that plant?
Riley, I think as we go through the next few days and have more information available, that will help guide and shape what we need to do. Bryan Health mobile site was there yesterday again, and they were there this morning as well. They won't be going tomorrow, but the National Guard will be there on Friday. So a lot of that will be based on what information we get from those testing results and the impact that's going on in Lancaster County from that.
Director, this is Bill with 1011. You said 23 cases over the last 4 days. Do you know how many total? And also, are you able to say how many of those are employees and how many are close contacts?
Of those, my understanding, Bill, is that they are all employees there. We wouldn't count close contacts unless they were positive cases. So right now, because things are still under investigation, having the 36 new cases today, which they're bringing to a close of investigation, I should have more information tomorrow that's more accurate for you.
Okay, and then the 23, is that the total, or were there some others in previous days?
That's the total.
Director Lopez, Riley with the Journal-Star. Earlier this week, I think the mayor spoke about the DHM process and how initially you instituted our DHM here, and then the governor's office instituted a concurrent DHM with some minor variations. Could you explain what those variations were between what we had and what the governor's office had? And, what is there going to be any sort of variations going forward that need to be addressed when we approach May 10th?
Again, Riley, it's just all very determinant on about how things unfold in our community in these next few days, about what that will look like. We try to have really clear and good communication with the governor and express our concerns. He's well aware of that, and his goal is to do the right thing as well. So when we first were looking at the DHMs, we really wanted to include those services that included that close contact with individuals. So later when the governor issued his DHM, remember, they include other counties besides Lancaster County. So we responded specifically to our community and the needs. Like the salons and the barber shops that we were talking about.
I have a question from Kellen at KLIN. How does the statewide DHM regarding churches reopening on May 4th apply to Lincoln? Or will churches be grouped together with the DHM on May 11th?
Our understanding that the governor is issuing the DHM for the May 4th churches probably tomorrow or the next day. And it's a statewide DHM.
So that means that churches in Lincoln will be able to have services
Right.
on Sunday?
Churches will be able to, not on Sunday. Monday is May 4th.
Okay.
Just as a reminder to everyone, I've been getting a lot of calls about that. But Monday is May 4th. So no church services this weekend,
When church,
other than virtual.
when church services in person resume, what are the restrictions on those services?
It's our understanding that it will be similar, that families need to stay together, and I believe it's our understanding that the governor is going to post some guidance on the website when he makes the announcement. And there's been a lot of discussion with our faith leaders across the state on how, what is needed to be done to ensure the safety of individuals. But we also want to remind everyone that you can still attend services virtually. We still don't want people that are at higher risk with underlying health conditions attending a service. So we will have more information as that unfolds.
Could you remind people they can get to the state website through those?
Yes, and Diane's just reminded me to share with you that you can get to the state website through the City of Lincoln website. And the restaurant guidance that the department developed is posted on there as well. But we'd really like you in Lincoln to look at the guidance that we provided and provide us feedback so we can tailor things to our needs. Thank you.
Riley, just to clarify on that question about what was different between our initial directed health measure and the states, we had included nail salons, barbershops, et cetera, as places that could not have, that couldn't convene because of the close contact. So they were under that section on public gatherings and convenings. Later, the governor did actually add a provision like that to his DHMs, but initially, in the very beginning of all this, those were not a part of what he had issued. Again, we've all had to really continue to monitor and adapt throughout this and evolve, our recommendations, and we're trying to do the best we can in a very fluid situation. Any other questions from the media? Okay, well, thank you for tuning in. Thank you so much for everything you're doing to help protect yourself, your family, and everyone in our community. We'll be back again tomorrow at 3:30.